Hi guys. Good morning and welcome. It is Thursday, October 19th. How are you, Katie?
Fabulous. Enjoying this weather outside.
Oh my gosh. I was like, are we even in Florida?
Doesn't feel like it.
It doesn't. So guess what today is? Today is Wear Purple Thursday for Domestic Violence Awareness. We both are sporting this purple. I got some little sparklies going on. She's got some lovely jazz with her
periwinkle.
Yes.
It's my closest purple.
Shades. Yeah, I know. I had to search high and low for this. But hey, purple, as we talked last week, it is a color of
awareness for domestic violence.
Yeah, but me and Julianne were talking about the origin of purple.
Oh.
And back in the 1900s, they it's like loyalty, purity, courage, I think. So hence why it ties in.
Yeah, perfect.
So if you guys are on, please give a thumbs up, a hello. I am here with Katie, and she is going to talk today about the effects domestic violence has on children. She is going for her master's in social work, and she has taken some courses on this information. So we wanted to pick her brain, bring her on here. So thank you for joining us. And we are going to jump into this topic. So if you aren't aware, October is Domestic Violence Awareness Month. We've been posting stuff about it. And this week is Take Action Week. So this is all about how we can help. So domestic violence, you guys, the effects that it has on children is, I was reading up on this, pretty astounding.
Yeah.
What are let's jump into statistics.
Yeah, numbers.
Really
Yeah, get an idea of how far-reaching this really is. 3 to 4 million children, what are the ages? 3 to 17 are at risk of exposure to domestic violence.
15 million. I don't think people really grasp that number. That's a lot.
And it's a lot because when you think about exposure to domestic violence, that doesn't always even have to mean that they're just they're in the room and they're witnessing it. It's more than just seeing, it's feeling the tension in the household, feeling afraid. So there's a lot that goes into the exposure of it.
Yeah, the witnessing part of it. She said it's more than just seeing it, but hearing it, feeling it. I'm sure there's a lot of deeper levels that go on with that. So she just said there's 15 million kids, that witness this. In terms of maybe boy versus girl, we have some of those here as well.
Right. Let's see. When we talk about sexual abuse, we have 1 in 4 girls and 1 in 6 boys that are sexually abused before the age of 18. Young women between the ages of 16 and 24 experience the highest rate of intimate partner and sexual assault. So that's the main group that's highest risk for that.
And children that are exposed to domestic and sexual violence, what are some of the things that they're more likely to do?
More likely to do?
Yeah.
So they're more likely to attempt suicide, abuse drugs and alcohol, run away from home, engage in teenage prostitution, and commit sexual assault crimes.
It's a lot of stuff, like heavy stuff.
Yeah.
And that's just being exposed, to it.
Yeah.
Wow. It's a lot. So she had mentioned 3 to 4 million children between the ages of 3 and 17 are witnessing this happening to their own mothers. What are some feelings maybe these children are experiencing during this?
Well, when you think about children at young ages, what they're really needing is to feel secure and safe in their home. So it's common for children to feel anxious, fearful, on guard, just not feeling safe. It could even lead to feelings of worthlessness and powerlessness. Just always kind of walking on eggshells and not being able to just relax in your own home and be a kid, worrying about your safety.
Right, because they're wondering maybe, when is this going to happen? What's going to set the person off, maybe?
Kids need consistency and safety, and those things are hard to come by in a household that there's domestic violence going on, for sure.
Do children take blame for these kinds of acts? They do?
They can look inward and feel like it's their fault. A lot of times abusers find scapegoats in the family, whether it's their intimate partner or children. So that can lead to them thinking that it's their fault.
Wow. Jeez. Okay, and we also were talking about children feeling isolated before. Can you touch on that a little bit?
Yeah, so in addition to needing safety and consistency, kids need attention and love.
Children
and
need
time.
attention?
Oh, yeah, they do. So if you think about it, if two intimate partners are constantly involved with this cycle of abuse, the tension building phase, the actual abuse, there's not a lot of time left over for the kids and what they need. Mom's always worried about her safety and keeping her kids safe, and the abuser's occupied with control and, feeling like it's their roost.
Wow.
So
There's a lot going on. They don't feel like they're getting the attention that they need and they deserve. Okay, interesting. So then if they're going through all of this, all these feelings are happening, what are some behaviors maybe that a child might be experiencing?
Yeah, so there's three main responses that you can look for. There's emotional responses, so the way they respond to everyday things.
Sure.
Maybe they drop something and break it, where some kids might pick it up and go on with their day. It's a total breakdown, or acting out in anger, just not being able to manage their emotions for their age and their developmental stage.
Right.
And it's going to vary across individuals, and of course you have to take into account their maturity level, but it would be out of the norm emotional responses, or just shutting down and keeping to themselves.
Right.
It can really vary.
Interesting. So we're touching on behaviors that children might experience, and she just touched on emotional responses. What else are we looking at here?
So there's also physical responses, which sometimes you're not always thinking whenever it's witnessing abuse or emotional abuse. That can affect you physically. Tummy aches, headaches, anxiety can manifest in physical form, so that's another big red flag or sign to look for.
It's a huge one. And what's another type of behavioral response?
Another, or an actual acting out, action behavioral response, again, is going to vary greatly, and it's going to be individual to the child. So shutting down, not engaging in activities that they used to find stimulating or interesting, or acting out for that attention that they're not getting at home. Maybe they're the class clown, or they're bullying other kids, acting out in ways that they're going to get attention, not always positive attention, but just any attention that they can get.
So I'm hearing is it's very individualized, and there's a realm of different types of behaviors that one might be utilizing.
Yeah, that's why it's important to be trauma informed, to know that
trauma informed.
Everything that you experience has its effect. And
so you see a child maybe acting in one of these ways, what is your recommendation as maybe an adult who's witnessing that or seeing that?
It can be easy for people to jump to, oh, that's just a bad kid. They've always had a problem. They're just difficult. Instead of jumping to that kind of judgment, maybe slow down and think, I wonder why they're acting this way. What might have happened that they've learned this behavior, that they're seeking attention in this way, and come with an understanding heart to try and get to the bottom of the problem.
That's really good information. Don't just assume, hey, that's a bad kid or a kid acting out. Actually care, maybe. Ask a question, or just take concern.
And be patient. Yeah.
That's good. That's very good. Yes, children and patience can be trying, but that's awesome. So maybe, we're talking about some different behaviors that children might be having from witnessing domestic violence. What are some long-term effects?
Long-term effects can be staggering, and that's another reason, the buzzword trauma-informed care. A study to check out would be ACEs, ACES,
Okay.
stands for Adverse Childhood Experiences. It's kind of like a checklist test that you can administer and see how many ACEs you have, and the higher your ACE score, the more likely you would be to have longer-term consequences. So back to the physical, people that experience trauma in their childhood are much more likely to have physical problems later in life, to die at an earlier age, have heart disease, stroke,
Dang, I didn't know that.
abuse drugs and alcohol. So it takes its physical toll, and then it takes its psychological toll as well.
Sure.
Um,
Absolutely. And where ACEs you were mentioning, where if somebody's like, hey, that actually sounds kind of interesting, I think I want to
Look
maybe
into
look
that.
into that, what would they do?
You can probably just Google ACES, and it's Adverse Childhood Experiences. We can put a link on this too if someone
great.
wants to check it out. It is just interesting. It was a study done in the late 90s, but it was a really large pool of participants, and it's definitely relevant today.
I bet.
Sure.
Yeah. Okay. Very good information. And then we were talking about children being at higher risk for witnessing domestic violence. What are some of those things that they're at higher risk for?
If they've experienced it before.
I know you
Okay.
mentioned alcohol and drug abuse already.
Juvenile delinquency and interaction with the criminal justice system is definitely, there's an increased risk there. PTSD, post-traumatic stress disorder, just one of the mental issues that one might face after growing up in a household with domestic violence.
Yeah.
Anxiety
imagine.
disorders, depression, and then it's also a big predictor of adult criminality, not just juvenile delinquency, and domestic violence is the number one reason that children want to run away from the home.
Wow. Wow. That's a lot of stuff. And I'm sure, children, that's a lot for them to absorb and take in, and they just don't really have maybe the resources
Or the coping skills.
or the coping
yet.
skills or the people to reach out to even know how to even begin dealing or handling this stuff. What's something that maybe if a child and or they could do to reach out for help?
Talking about children, if you have a trusted teacher or coach or adult that you can go to maybe at school, that's always a good place to start. You can always call a 24/7 hotline. Like
Children can
211.
call 211?
Yeah, I was
Wow.
on call yesterday. We have a
Yeah.
supervisor on call to help if there's ever difficult calls coming in, and we had a 13-year-old calling us yesterday that just needed some counseling and support. So
Oh my
they
goodness.
call.
They
and-
dialed 211
Yeah.
and 211 was able to do short-term counseling?
Yep,
Wow.
we were there.
Did you hear that? She is saying that children do call 211 and other hotline services as well. But we do have a small, I would say, percentage of children calling in, whether that's 12 and under or that 13 to 18 age range. So, and I have children and they're already asking for cell phones. So, and they're younger. So I know that age group has these phones.
Oh yeah.
So it's not like they don't have access to the phones.
Yeah.
So they're more than welcome to call. Or like she said, mentioned, a trusting adult. That's always a plus. Okay, so references, ACEs, we'll put a link to that below. And we do have a Help Me Grow program that does, can you touch a little bit on that and how that might tie into this as far as screenings go?
Certainly. So Help Me Grow, it's for any child 8 years or younger and their caregivers and the 211 service area, so Leon and the other 7 surrounding counties. It's a care coordination program to help identify any behavioral, emotional, developmental, intellectual issues that a child 8 years or younger may be facing, and then We can do over-the-phone screenings to kind of pinpoint what services they might be needing, and then refer them to services and follow up with them 6 months out, just to keep in contact with them, make sure that they're not experiencing any barriers to services, to make sure that no kid falls through the cracks or gets left behind, because early intervention is super, super important.
Wow. So you just said that they do the screening, and then we have a coordinator that is with this child or family for months to come. That is super beneficial. Wow.
All you need to do is call 211 and let the counselor know that you're interested in the Help Me Grow program. That's just one small aspect of what they do. They have a lot of outreach in the community, screening events where you can go in person and meet with our wonderful
Which,
staff.
I believe there's one tomorrow, now that I think about it. We'll put down that information below if you guys are interested in attending that on-site screening that Help Me Grow is having tomorrow. Cool. Do you have anything lasting information that effects of domestic violence might have on children, or do you think we covered it?
I think we covered a good amount of it. Just want to give another shout out to the Refuge House.
Oh my goodness, yes.
A great resource. They have a 24/7 hotline and a shelter that you can go for a safe, confidential place to stay.
Because we were reading up on this earlier, what is one of the pressing concerns for survivors of domestic violence?
It's homelessness. Domestic and sexual violence is the leading cause of homelessness for women and children in this country.
Wow.
There's a lot of barriers to finding stable housing away from an abuser.
Right.
It can be really debilitating to have that on your shoulders and feel like you don't have many options. But the domestic violence hotline, which we can also share below the number, Refuge House, and 211 is a great starting point for resources in that respect.
I mean, you got to get started somewhere, and resources and information will do that for you here at 211. Just pick up that phone, dial 211, and we will get you in touch with the help and the hope that you guys need if you're going through this or you know somebody that's going through this.
Yes.
And again, the Refuge House, and we'll put up that number as well for anybody that may need it. Well, cool. I just want to thank you, Katie, for letting me pick your brain about this topic. You guys, we're just get the conversation going. It is still October. Of course, we don't want to just stop in October, but keep talking about this, because the more we talk about it, hopefully we can actually put an end to it. That'd be awesome.
Yes, it would.
So, you guys, 211 is your region's crisis go-to hotline. With help comes hope. Until next time. Oh, next week we have a special guest.
Ooh.
Yes. Well, we'll keep it a little hush-hush. But you'll want to tune in next Thursday for a live chat, again on domestic violence, but special guests coming your way. Thank you, Katie. For
tuning in.
Yes. Thank you, Katie. You guys have a good weekend. We'll chat later.
Bye.